BMAC stands for bone marrow aspirate concentrate. If you want to get technical, some people you say bone marrow aspirate cells. Either way, it comes from the bone marrow. So our bone marrow has stem cells and it has many other cells that help the stem cells. Stem cells are cells that can turn into anything. They can turn into lung, heart, liver, cartilage, tendon, muscle, bone. And so in our body, every day when we walk around, I'm simplifying things, but we kind of get little microscopic cracks and breaks and we beat our body up. Then we go to bed at night and our bodies heal ourselves. And the cells do the work. So the stem cells are what do the healing and the repairing, and the growth factors from the platelets and a lot of other areas help feed those cells to do what they need to do. We know that as we get older, and I alluded to this, that we don't have as many stem cells in our arms and our legs. So we don't have as many repair cells. So our knees might start to break down, or our shoulders might start to break down, or our bodies start to break down faster than we can repair ourselves. And we start to get little microfractures or strains or sprains or overuse injuries, tennis elbow, things like that as we get older. Our bodies still have a good ability to repair ourselves, but it definitely slows down as we get older, especially if we don't eat the right nutrients, we don't have the right diet, we get overweight, we eat too much sugar, we don't exercise, our muscles get weaker. That's going to cause more of that wear. That's going to even add more to that wear and tear. But the bottom line is not having enough stem cells in our extremities does cause us to start breaking down faster than we can heal ourselves. So there are certain areas of our body, like the pelvis, which still have really good stem cells right up into our 80s. So if we can take good stem cells from an area that's pretty easy to access, it's not your spine, it's not your hip, it's your pelvis right in the back of the kind of above your butt. There's a couple areas you can feel. They're called your PSIS, your posterior superior iliac spine, and we can numb the area up. And literally in the office, we can put it. It's a little bit bigger needle than the needle you would get for a shot, but we put a needle in there and we are able to concentrate and draw out the bone marrow aspirate, which has stem cells and other cells that help the stem cells. And then we are able to inject those into other areas of the body that need healing. In our experience, and also I think if you look at the research, the cells do the work and the cells tend to work better than quote unquote just PRP. As we get older, our platelets aren't quite as good. So when you're in your teens, the platelets are very, very powerful, and sometimes you just can do fine with just the PRP. As we get older, 30s, 40s, 50s, definitely 60s, 70s, 80s, 90s, the cell therapy, in addition, we always use the PRP with it to help supercharge those cells. It really works better for the bone. You need to use the cells, like the Dr. Hernigo study that we talked about with the knees last week. It's completely different than PRP, but it's kind of all under the same category of regenerative medicine, ways we can use our bodies to help heal ourselves.